role, I help future healthcare providers learn how to work with people in a health literate way and build health literacy. I'm also a fellow for the Kalamazoo Literacy Council. And in that role, I do kind of the opposite end of health literacy. So basically, I increase health literacy for people who are learning how to read and people who are learning English. I have no conflicts of interest. If you haven't downloaded the worksheets, please do that, and we will be using them in a little bit. So I did have a survey here, but since I just got online, I wasn't able to put this into the survey instrument. So usually when I present this in person, I try to find out who's here so we can kind of talk about how to make partnerships with different people that are here. And I use small groups quite a bit. In this instance, I won't be doing that, but we'll find some other ways to kind of share some of the issues. So what are health plus English plus literacy programs? Well, these are programs that are entitled to do basically those things, to increase people's health knowledge, to help while at the same time increasing their English ability and their literacy skills. So learning English includes listening, speaking, reading, writing, and listening. Sometimes we work with people that are just learning literacy skills, which would be the reading, writing, and reasoning. And then also at the same time, increasing their health literacy. In my opinion, these programs really must help language learners engage in their local health practices, not just kind of general ideas about health, but also what happens in their local health practices. So today's objectives are to explore the development of health plus English plus literacy programs. We're going to look at those essential elements that are part of this, all of these kind of programs. We're going to look at building and maintaining partnerships, including several different types of partnerships. We need to look at kind of new needs that came along during the pandemic for our program. We want to address potential barriers and also what's the role of the facilitator in these kind of programs. So let's first look at those essential elements. In these programs, the kind of things that we need are health expertise. So you need somebody that's involved in the program that brings health expertise. You need some of that language learning expertise. If you are working in a literacy center with people that are learning literacy, then your language learning would be, that would just be the literacy elements. You really need a familiarity with learners, and I find this is particularly true with immigrants, with people that may be undocumented workers that have some risk in attending programs like this. You also need an approach to challenges and barriers. Some of the biggest barriers for people are things like childcare, transportation, digital literacy is a barrier. When we look at the differences with online programs, what we'll see is that took away some barriers and it included other barriers. You need space for your program. You need some kind of volunteer or paid staff or some kind of combination of the two. You need funding, curriculum, and supplies. We did move to our online learning, and so the new needs for an online learning is you need program delivery technology. So that's, we all know there's Zoom, we know there's WebEx and different programs. They have different elements to them. and you may need to go above a free form to deliver the elements that you want. You also need technology for learners and for volunteers. There still is a digital divide, so technology for learners is a major obstacle, as well as websites or hotspots, so that people have reliable internet to learn. Along with that comes this technology support and training for learners, teachers, and volunteers. So, for instance, in our program, we had people who were pretty new to the country as immigrants, and they came from refugee camps. They basically, many of them had little schooling, so they basically needed a lot of support to get online and learn how to do that, whereas other of our learners, of course, were quite able to do that. We also need curriculum that's appropriate for online teaching, which is harder to find than you would think, and especially when you consider that online teaching can vary quite a bit with different teachers. You need interpreters to assist in technological onboarding. We have English immersion courses, so this was fairly new to us, but we found that this was not possible to do without interpreters. You also need assistance in the classroom just in case of technological failure. So let me talk a little bit about our program, and then we'll get into some of the other programs that you have. So in terms of our pre-pandemic program, which was the last 2 years, we had a structure that was set up for to engage, and we just do adults because we're a literacy center for adults, to engage those adults at the same time that the public school had summer school. So we had a 5-week program for those adults because that helps with the childcare. And then we met for 3.5 hours, Tuesdays through Thursdays. We had a break in between, and we had snacks and things like that. And we also had learners choose Monday or evening classes. So we had childcare provided in the morning, but then people that work during the morning. So for instance, we have a lot of learners who work at a meat packing plant, and they could not come in the morning. We had to change all of that this year when we decided we had to go online. So our pandemic structure is a little bit different. We did still do the 5-week program for adults in the summer during the same time as school. School was much different for their children, however, and so we had to think a little bit about the use of technology at the same time their children needed technology. And we had to do some surveys to figure out when was the best time for that. We also are meeting more days, fewer hours, because we don't have the break in between, and it's too long to be online. At least we felt that way. We see now that with our more advanced students, we probably could have extended this a little bit. But right now we're meeting an hour and a half on Mondays through Thursdays, and learners chose morning or evening classes, again, like we did when we were on campus. We moved to totally online delivery, and we did that fairly late because of the pandemic, so it really cut into our planning time. And I have to say that one of the issues with putting things online is it hurts your head because you have to think through every little element of how to do things differently. We had to do all our registration and tech training that was completed online. So we had volunteers that were calling people to register them. And of course, recipients with limited English. So we did have to use interpreters for some of that. Many of you know that if you work in English language, usually there's a test that goes ahead of that, and to help us place people, and we didn't have that. in the online environment either. So we had to kind of adjust to where we might place people. We provided a variety of resources to teachers with a kind of adaptable curriculum, and we relied on breakout rooms for the more advanced learners. What we did find is that we had to simplify what you do online, so that becomes a little bit tricky as well. And then we use volunteers as classroom assistants just in case there's problems with technology. A little bit more about our program is our delivery. I already said is English immersion. We have used a variety of curriculums. We used a 2018, we used What to Do When Your Child Gets Sick, the HELP curriculum from IHA. In 2019, we used Simply Good Nutrition curriculum. This is actually a SNAP Ed curriculum in Michigan and probably in other states. So we were able to get some SNAP Ed funds for our nutrition curriculum for that year. And this year we're using the Staying Healthy Florida Literacy Coalition curriculum with supplements from Wisconsin Literacy and also COVID-19 resources that we've developed or found elsewhere. For our particular program, we have a variety of learners, but our most common countries are the countries here, Congo and Syria, because of our emphasis on refugees. We are a farming community. We have a lot of migrant workers, but what we have found is that many of those migrant workers who speak Spanish are more comfortable going to a literacy center that is in the Spanish-speaking neighborhood. It feels safer to them. What we learned about going online, a few learners refused to go online. Most people would said, okay, we can do this. A few people had a hard time getting there, or some people had a hard time staying there because of chaos in their own home with a lot of kids around. We also found out that more learners actually came in the evening than came to an on-the-ground program in the evening. We had a lot of relatives and friends that stepped in to help to get learners online who didn't know how to do this. And when there wasn't somebody there, we had to put a lot of time into closely working through that online process. We put PowerPoints together so people could see what they're supposed to see on the screen. We used interpreters. We did whatever we could to do that. For our lowest levels of English speakers, we needed to keep technology demands very simple. So we didn't do breakout rooms for that group. We used a platform that they were already familiar with, most of them were, and the others would use in the future. And then we incorporated the rest of the family into classes. If you're gonna be online, you're gonna have cats and dogs and children around. So we, in our classes, if a child comes into the room, we talk to them and we work with the family. Sometimes we'll ask them to bring their children in the room. Right now we're doing body parts, and so we'll do head and shoulders, knees and toes, and we'll help our learners teach our children that song, or sometimes the other way around. Okay. Your handouts is for your ideal program. So now you've heard about mine, and what I want you to do is to take your handout, and I'm going to give you a few minutes to fill out ideas about who would your participants be, what type of topics would be most important. So I have a number of different ones here. Accessing healthcare, perhaps you're in a hospital and you want to have people navigate your particular hospital. Perhaps you are, a cancer center and you want specific things about disease. So answer those questions. I'm going to give you a few minutes, and in the meantime, I'm going to actually also look at the question and answer. So, and then also whether you would do online or on ground. Okay, so I do have a question here about what motivates them to come. And it's a question about, are they already are patients in your healthcare system? So these I have, mostly we get people from the English language program, from the Refugee Resource Council, that by default, they're patients in healthcare system. We are not, one of our essential partners is not a healthcare system, but that certainly could be an essential partner. Okay. Okay, so I'm hoping, like I said, usually when I do this presentation, I break people into groups so that you can kind of brainstorm about some of these elements. And we will, in the later elements, look at some of the brainstorming. But for now, let's move a little bit further and start talking about partners. So partnerships to me are extremely important in health literacy. I think that health literacy is a team sport. Even if you just think about Ruth Parker's graphic for health literacy being kind of this teeter-totter where you have, you know, the demands of the healthcare system versus the skills of people that are accessing healthcare or health of any kind. There's two parts to that, and we can't all be experts in all parts of it. So I think it's really important to have partnerships. I think of partnerships as three different types of partnerships. The first one is essential partners. So essential partners are the kind of partners in your community that have kind of their finger on the pulse of the community. They're partners that are looking at a particular issue and then trying to figure out how to work with that issue. They generally come in, there's other types of essential partnerships, but they come in like coalitions, which are groups with similar goals that are putting together community planning. They're trying not to duplicate services, and they're looking at what kind of needs that need to be identified in that particular area. And I'll show you one of these in a minute. Advisory groups are groups that encourage new projects and partnerships, in particular coalitions, in particular kind of groups that can contribute to that. Both of these partners have some idea already what the needs are in your community. So when you have essential partners, that's a very important to be able to find some of what the needs actually are. Organizing partners, on the other hand, are partners that organize and implement an intended program. So we had organizing partners in our particular program. And contributing partners are partners that can contribute one or a handful of elements to any kind of intended program. They often contribute supplies or volunteer positions. So for instance, one of our contributing partners is our lifelong learning group. So they like to, they pass the hat for supplies. They have volunteers in their group that will volunteer for the program. If we first look at these essential partners, think about this as the ones that know the community, they build for the future. They're usually partnerships of groups that are working in particular areas and have been for quite a while. We have two that have been for a while that helped us get off the ground very quickly when we decided to start our programs. So the first one is the WMUKLC Advisory Board, and the other one is the Adult Literacy Collaborative. Both of these helped us to recognize needs and kind of explore solutions. So that's part of what they do. The Literacy Collaborative basically has the goal of building literacy skills that are necessary for everybody in our particular county. It's a collaborative of groups like the schools, the community college, the adult education groups that work on literacy outside of the schools. We have a prison program for literacy. We have programs in our homeless shelters for literacy, and this also includes English language learners. So this isn't the case in every place that adult literacy and English language learners are linked, but in our particular community it is. And we found this to be very helpful, actually. So they meet on a regular basis and they talk about where is the holes in adult literacy and what can we do to strengthen adult literacy in our community. We also have advisory board that is a group that are Western Michigan University people and also Kalamazoo Literacy Council people. And basically they try to develop concrete kind of community university strategies. This is an advisory board that pulls in a lot of the university along with the literacy center. We also have a med school that is associated with the university, so they also participate in this. Some of the areas we do a adult literacy research and training symposium every December. We do other kind of programming and some research activities along with this. If you look at the bottom of the page, we see workforce literacy, parent literacy, health literacy, ESL are kind of our 4 areas of emphasis. And parent literacy has become bigger and bigger with the COVID-19 and people trying to educate their children in the home. And these kind of go hand in hand. So if we look through these essential partners, then we were able to see some of our needs just by these 2 groups. So we knew that there were limited English learning programs in the summer. So the English learning programs tend to go in a school year, and people lose their English, much like kids will lose their academic skills after in the summertime. We also know that there's limited health content in most English learning programs. A lot of the books that are aimed at English programs have a little health here and there, but unless you pick something specifically for health, It's not sustained in any great way. We also know that there was a new community literacy center that really wanted to attract learners and wanted to fill this gap in these two ways. We also knew that the refugees really needed assistance in managing health matters, that we weren't attracting refugees in our regular ESL program, and that the majority of our learners were actually parents. Thus, that's why we chose what to do when your child gets sick for our first year. So since we saw the gap with refugees, we added a new partner. So our new partner was the Kalamazoo Refugee Resource Collaborative. They have services that support refugees. They actually did put together an English language summer program in 2017, but they only had 1 year of funding, so they weren't able to continue with that. But with our partnership, we were able to do that. And because they knew those learners and they were working on an ongoing basis with resettlement groups, this was a very important partnership for us. So this is what ended up with our organizing partners. The Kalamazoo Literacy Council, the Kalamazoo Refugee Resource Collaborative, and this church, the Westwood Methodist Community Literacy Center, was one of the literacy centers that actually is already connected to the Kalamazoo Literacy Council, but was having a hard time attracting learners to their part of the of town because they were fairly new. So once we get these three people together, this is what we actually found was already in place with our partners. We had health expertise, primarily through my connections at the university. And also I'm in a number of different groups that we could pull on health expertise within those groups. The language learning expertise came from the ESL of Southwest Michigan, which is part of the Kalamazoo Literacy Council. So we already had trained teachers there. We also have a program, an ESL program at the university to teach future teachers. The familiarity with learners came from the Kalamazoo Refugee Resource Council, and an approach to challenges and barriers came through the church was able to give childcare, and they were also able to do they also were on a bus route, so people could get there on the bus. We happen to have in our community also a community program that helps disabled folks get on and off buses, and it's a bus training program, and they were willing to extend that to some of our learners to help them use the bus system. We had space for the program at the church, so there was quite a bit of space, and especially because it was summer and it's not used as much in the summer. There were volunteers and paid staff both at the Literacy Council and with the ESL of Southwest Michigan. We also had volunteers through the church, and other people had volunteers in various ways. We had funding that primarily came from the Literacy Council for hiring teachers, and then funding came from the church social justice fund to work to hire childcare workers and to help offset some of the issues with supplies. We didn't quite have a curriculum in place or supplies. This year we had, of course, new issues. So the program delivery technology we were able to put into place through the church fund, the social justice fund, paid for Pro Zoom. And because they didn't have to do childcare this year, they paid for that instead. Technology for learners was something that we had to develop more, but the Literacy Council was already working on that since COVID started. And our technology support and training for learners, teachers, and volunteers was something we had to incorporate to a higher degree than we had previously. The curriculum appropriate for online teaching was one of our big challenges because there isn't as much curriculum for online teaching. And online teaching that doesn't use bells and whistles, basically, because a lot of our learners couldn't learn the bells and whistles quickly enough to get into the program. We needed interpreters, which we already had in place through the Kalamazoo Literacy Council, and assistants in the classroom. So we really need to engage some volunteers. So I want you to look at the next part of the handout. So if your ideal program, I want you to think a little bit about where would you find these elements in your community? Do you have existing partners to help identify the need? What do you bring to the table? And what do you need for organizing partners? Who would be the best organizing partners? Now, I have a lot of questions here, but I think perhaps the best way to engage everybody would be to think, I'm going to use the question and answer section again. And this time, what I will ask you to do so that we could share our knowledge about what resources are in our communities is to think about where would you get these resources. So if you already have these resources, tell us in what venue. Is it a hospital? Is it a clinic? Is it a church? Where is it? So we're just going to focus in on where the red ones now. So health expertise, language learning expertise, familiarity with learners, an approach to challenges and barriers, volunteers or paid staff. Where do these resources come from in a program like this? If you don't have them, where in your community could you get them? For instance, one of the things that you may not be aware of is sometimes you can find health expertise actually in 4-H groups because they have health literacy as an area of focus. So sometimes these are surprising where you can find them. I'm working on this side because usually this side is where you get the organizing partners. So I'm going to open up the question and answer, and please fill in there. And you can also look at your sheet for some ideas for your own community as well. Okay, here's some ideas here. So a public library literacy program. Libraries are a great place. We have tutors in our libraries, and they often have the space. They, can recruit people to come there, and it's a wonderful public area. They also might have online right now. I know our local library has some online. Health expertise, volunteers, community clinics, local community colleges, volunteers, Local health coalitions, that would be an essential partnership that would have lots of resources and would be able to do some of that. One of the things that we have is we work with our local Head Start and work with the parents there, and you know that there's a long term element of that in with what to do when your child gets sick. County health departments, free and reduced cost clinics, federally funded programs, nursing schools, medical schools, insurance navigators, local tech colleges, extension programs. Community college for language learners and educators. Safety net hospitals that conduct studies on health disparities. Lots of community outreach programs come in some of these large hospitals. Also, I should say that if you don't have access to essential partners, most hospitals have a needs assessment, community needs assessment, and that would work well. Community health workers, oh, they're wonderful. Health science librarians. Catholic Charities, that's a good partnership. Partnerships with resettlement groups. In our area, that's Bethany Christian Services. Okay. One thing I didn't mention too that we could mention later is partnerships with people who have technological experience with the online environment is a good one. Internships, education internships, health internships, YMCA, YWCA, homes programs, lots of great ideas here. Schools of medicine. United Way also does assessments in a lot of communities that can help you figure out what's needed. Peer-to-peer coaches. Church community outreaches. A lot of churches now actually have lots of open space or would even have space if you needed office space. LinkedIn groups on Facebook. I had never thought about that. First responders and law enforcement. These could be great resources. We have trouble sometimes with people calling 911 without understanding when to call it because they're immigrants. And that's an important thing. The HEAL curriculum, people say, you know, that's a good a curriculum for ESL instructors. Oh, local jails, low income housing. There's a lot of places where, you know, we do have some classes in our low income housing area, homeless shelters. I'm sorry, I know you can't see this. It's I'm hoping that we can get some of this to you in the future. Visiting nurses is a good possibility. Public health students. Good. All right. That's just some ideas. I want to again stress familiarity with learners is very important. A lot of people need to trust the people they're working with, so having a partnership there to help with that is a good idea. And let's maybe talk a little bit about working with organizing partners. So I want to define a clear roles of each partner group. Make sure that you have a set idea what health literacy is in this particular context. For instance, what I said earlier is that health literacy to me needs to look at what is the local health customs. Think about your partner's limitations as well as strengths. If you have a partner that has paid employees versus volunteers, it's completely different. Our Kalamazoo Refugee Resource Council, everybody there is doing this on top of other jobs, and so they have much more limitations. You really have to look at the differences between employees and volunteers, and those of you who have worked with volunteers know this well, that you can't expect the same things from volunteers as you do employees, but you can make your needs clear. Your organized partners should brainstorm together about any kind of needed elements in the program and work together to find contributing partners. You need a facilitator that kind of takes the lead in your partnerships. They need to lead the planning and brainstorming process, maintain and negotiate clear roles, keep the group on task for established goals, mediate any kind of conflicts between partners, and then work on that overseeing of the day-to-day functioning of the program. There are some possible barriers to success. Our partnerships take time, and it's easy to be pulled into too many meetings. So for instance, my program works on ESL, health, and parent education. So I could be pulled into meetings for all of those elements over and over again, and the refugee groups. And I have to kind of say, okay, I can't contribute to every element here. The program can become too complicated when you're trying to please everyone. Last year, we had a cooking element to our program when we did nutrition. The cooking element itself would have been fine, but in order to do that with as many people as we had 90 people last year, so it was a big program. To get into 2 different kitchens within the church, we tried to do some tutoring and some bingo and some other kinds of things, and really trying to get the volunteers for all of that, and getting people moving around was much too complicated within that time. So we learned from that. The learners really need to trust the organizers, and I've already talked a little bit about this. And the program must address the barriers that learners deal with: the transportation, the childcare, technology, etc. Now let's do one last piece here. The last part of your handout is your ideal program, and then what elements are left over after you have defining organizing partnerships. Then you want to brainstorm about contributing partners. So we're going to do this a little bit different, but you have that sheet and you can bring it home with you. If you haven't found it, when you came into the session, there's a section there where you can download the PowerPoint and these sheets. So make sure to use that. In our program, we were left with these supplies and the technology needs and the curriculum. But for now, what we want to do is go to the Q&A again. And these things that are in red, where do you find these things within your community? And I'm going to go to the Q&A in a minute. Let me just comment that we had The curriculum, we did a lot of online searching for curriculum. One of our problems with curriculum is that we have very low English learners and a lot of people who have no schooling. So most of the health curriculums are just not low enough. And we've had to kind of create and work on some of that, especially in the online environment. Our supplies, like I said, came from lifelong learning, and our technology needs now have, we are a little different. We have the Kalamazoo Promise, which is a group of individuals that send anybody who graduates from our high schools to college anywhere in Michigan. So we're very focused on education. So our education groups have been doling out technology for a while, and our library is now working on lending technology. So we've had some small grants for that and supported by the community. Now I'm going to go to the question and answer, and I'm going to read some of the things that people are saying about some of the places you can get these. Oh, here's some curriculum from refugee. Oops, I lost it. Oh, I'm sorry. I lost that one. It's a refugee curriculum. I have a lot of comments in here right now, so. Oh, space, libraries, senior centers, community education rooms. Oh, here's a curriculum from medical centers and North California Network. Oh, translators for curriculum. We do English immersion. Some people, if you're just working with one language, we've had up to 26 languages. But if you've had only one language, you can do some, like for instance, English and Spanish together. Some grants. North American Refugee Conference, here's the one that has some curriculum. Good. Community partners, grants. Medical schools, public medical schools, local school districts for technology. I haven't thought about that. Leveraging volunteers, this is a good idea. In the current economic climate, there are many who are volunteering to gain experience to put on your resume. Health education programs. Here's one for transcribers for disability learning. Local parks and community centers for space. Schools, offices, businesses can host drives for supplies. We actually have had Office Max contribute some things to us. And you know that dollar stores is a General Dollar that has the literacy element to it. A lot of people are talking about, YouTube for videos. Yes, that's really important. A lot of times for training on technology as well. A lot of people are talking about university programs. If you have a university nearby, they can be very helpful. on a lot of levels. Okay, we are running out of time, so I am grateful for everything you've contributed. There is a discussion on the link, so please go to the link for this session, and there's a discussion thing there. You can fill in ideas there, and I'd love to see them. Thank you very much. And here's my email.